what are the tests you would like to perform before this surgery?
The first test is done is called video EEG. Normally, all of you know that the regular what EEG is done is just for 1 hour or half an hour in the OPD. But video EEG is done with where the patient has to be admitted in the hospital, and the EEG is done for 2-3 days continuously, and the electrical activity of the brain is noted when the person has a seizure. So when the person has epilepsy, that time if we record, we can perfectly localize from which part of the brain does the epilepsy originate. So and then we decide where to go for surgery. So the first is to do a video EEG, and once we confirm that okay the epilepsy has come from the front part to the back part, to reconfirm that we do an MRI. It's a high, usually we need to do a 3 Tesla MRI, which is a high resolution MRIs which can predict or detect very minor changes in the brain. And suppose the EEG focus and the what is seen in the MRI they are similar, then we can go for directly surgery. Many times they do not correspond. If they do not correspond, then we have to do further test, like one has to do SPECT or a PET scan of the brain. So PET scan and SPECT scan usually they detect the activity of the brain, metabolic activity. So if when you do a PET or SPECT scan, we can see which part of the brain is very active. So the part of whichever is very active, that is the source of the electrical stimulus or the source of the epileptic focus. So if for MRI, video EEG and PET and SPECT, all of them are show a similar site, then we go for removing that part of the brain. So in turn, the patients can become seizure free.